Joining us now is the director of the Maine Center for Disease Control, Dr. Nirav Shah. Thanks so much for being with us. Maine just saw the most vaccinations given in one day last week, but now you're going to see 88% fewer J&J vaccines this week. How does that impact your vaccination push?
Well, good morning, Eva, and thank you so much for having me on today. The decrease in J&J vaccine that we are going to be experiencing next week here in Maine and across the country, it's disheartening. Of course, we all would have wanted the same robust level of vaccine supply that we saw coming in this week. But this decrease, let's hope it's one that's temporary, a mid-course fluctuation that will hopefully rectify itself. We're not letting it slow us down here in Maine. In fact, starting tomorrow, we are launching the use of a mobile unit that will travel across rural parts of the state using the limited supply of J&J vaccine that we have to make sure that we are continuing our two goals, not just to vaccinate with velocity, but to also vaccinate with equity. That mobile unit will reach hard-to-reach parts of the state to make sure the vaccine is that much closer to the arms of folks who need them.
And you've praised the advantages of the J&J shot for Maine. It does not require ultra-cold storage. It's only one dose. It makes it ideal for those drive-through sites, to homebound Mainers and people who live in the state's rural areas, as you were just talking about. So my question is, who's most likely to feel the effects of the distribution change this week and potentially for the next several weeks?
Well, you raise a good question, which is how long will this decrease in the supply last for? And we're working with federal officials to get a better sense. But even the decrease that we are seeing this week was one that was planned. Our federal partners let us know not too long ago that there would be a decrease, and we were able to plan for it. I guess, Eva, the way I think about this is that the vaccination of the entire country is not a one-week effort. And so even though this upcoming week we'll be seeing less vaccine, we hope that will recover. All that being said, there will be effects. One of the programs that we have launched and that I was very proud of were our efforts to say vaccinate folks who are homebound. That may have to pause a bit. But as I mentioned a moment ago, the introduction of a mobile unit across the state of Maine will mean that vulnerable, hard-to-reach Maine people will still have access to the J&J vaccine. We're going to be utilizing almost all of our J&J allocation in that mobile unit, so folks both in urban settings as well as in rural settings can get access to the vaccine.
Looking at the numbers that we're seeing right now, specifically in Michigan, I'm curious if that at all worries you and if you're looking at anything else, any other numbers happening in the country that are of concern right now.
Eva, it's a concern. We, too, have been tracking what's unfolding in Michigan. We haven't seen that degree of an increase of cases in Maine, but it's certainly something we're concerned about. I think this is evidence of just how opportunistic and tenacious the virus is, and further evidence that although there is a light at the end of the tunnel, we are not out of the tunnel yet. We've got to keep pushing ahead with vaccinations until we are fully done.
Dr. Shah, thank you so much. That reminder, we are not through this pandemic yet.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.